depending on how your family had you, more than likely your great-grandparents were born during the First Great War. They then grew up part of the Great Depression, and they went on to fight tyranny in World War II. They continued the fight against communism during the Korean War. They got us into space, and they ended segregation. But journalist Tom Brokaw described your great-grandparents, or possibly grandparents' generation, as the greatest generation. But let's look at your life. You were born at the time of September 11th and the changes that have resulted in it. Throughout your entire life, America has been in its longest war ever, the war with Afghanistan, which is now encroaching on 19 years. You lived through the 2008 recession, and now once more, you're seeing us at war again, this time with a virus, COVID-19. So, if your grandparents' generation, or great-grandparents' generation, is known as the greatest generation, I wonder what historians will put you guys down as. Maybe the most resilient generation. Because I've seen you being resilient in the way that you've handled these online learning days. You are doing a job of living in a resilient world during this global pandemic. A pandemic that has not been matched for 100 years. Today's conversation is going to be with Dr. Connie White, the Deputy Commissioner of Public Health for Kentucky. Fellas, welcome to Decades.
You want answers?
I think I'm entitled.
You want answers?
I want the truth!
So you're telling me there's a chance?
You believe in miracles? Yeah!
Right, oh my God, another plane has just hit another building.
I, Barack Hussein Obama, do solemnly swear
Mr. Gorbachev, tear down this wall. Not have sexual relations.
All right, fellas, welcome to our class here. Today we have a guest, Dr. Connie White. Dr. White is with the Kentucky Department of Health. Before she was a member of the Department of Health, she had a long career in medicine, over 20 years in medicine. Then she came to the Department of Health, then went to the University of Kentucky to do some instruction, and then came back in 2012 to be the Deputy Commissioner of Public Health here. Dr. White, thank you so much for joining us.
Thank you for inviting me.
I appreciate you being a part of here. We're going to actually go with this first question. We're going to actually have you reflect a little bit on your days at UK. Grades, of course, as you would know, would have been important.
Right.
And so the first question is this: what kind of grade would you give the Commonwealth of Kentucky in the way we are handling COVID-19 and why?
I would give us a B plus or an A minus. I think you look, not you as a high school teacher, but I would think you have to look at not only your outcome, but what did that student start with? And when you look at where we started in March, we had a couple of things that were barriers for us from the get-go. Number one, this was an illness nobody knew anything about. I know you've talked about novel and what novel means. And not only does that mean that the human body had never experienced it before, but the healthcare system hadn't either, nor had medical research. So as a physician, I am not very used to saying, I don't know, because it's my job to know. And I got very comfortable by the end of March of people asking me questions and very, very seriously saying, I don't know. And nobody does. It wasn't just that my lack of knowledge. It was, there was no knowledge to impart to people. So we were starting with something we knew nothing about. And we were starting with a public health system that is very used to surveilling flu, salmonella outbreaks, a rare measles outbreak, some chicken pox. I mean, we have a vast array of illnesses that we surveil, but the sheer volume of what we were looking at was more than the power, the bandwidth of our staff. And certainly the electronic surveillance systems, I mean, it is right, 2020. We didn't have 2020 collection systems. Right now we're on patch 6.0.5, I think, of our surveillance system that the CDC provides us. So the more data we loaded in, the more gaps we found. And so then you have to go back and redo things to fix those gaps, and then you put patches on the system to make so collecting that volume of data in that period of time with a limited crew of people was a huge, huge lift. And so that's why I think if you get some grade for effort, some grade for ingenuity, how do you, okay, we can't do this and this, so how do we figure out how to make it work? But we have to put that bypass step in to make sure that we can get everything as accurately and as quickly as possible, because decisions were being made based on data that we were collecting. So it was a combination of ingenuity and efficiency and a great deal of passion for people to say the lives of the Commonwealth are resting on us, and we have to get this right. We have to get it right. It's not an option.
Yeah, because it's a life and death situation here.
It is.
Speaking of March then, and it's good to hear that you're giving us a good grade. But when we looked at March, we had, if we take the numbers from March, April, May, and June, our numbers were just over 16,000 new cases here in the Commonwealth. In July, it looks like we're going to be on pace for about 14,500. So almost in our 1 month, we've almost matched those 4 months combined. In that survey, I asked our respondents in June, only a small percentage thought we were winning the war against COVID. When you look at numbers like this, are we winning the war against COVID here?
Well, that's a good question. And I haven't seen today's numbers. I'm down here on the first floor. The numbers are decided up on the second floor, so I don't know what July the 29th is going to show us. But I can tell you up until this week, we have had 6 weeks of increasing numbers, not exponentially, not right at this point. We have not had an exponential increase. But what we do know is other states who have had this gradual 6 weeks rise have seen the numbers of younger people being the higher number of cases when but their healthcare systems have handled it. And this is what Dr. Birx, most of you know Dr. Birx, who directs the COVID task force for the White House. She was actually here Sunday, the 20, I don't know, whatever Sunday was, the 26th, I guess. And she said that's exactly the pattern that Florida had, that Texas had, that Arizona had.
Okay.
And then they saw that exponential rise where you had 100 one day and 1,000 one day. You had just unmanageable volume. And so that's why she made her trip. She actually visited Indiana, Ohio, Kentucky, Tennessee, and Florida, because Virginia, because there's concern that all of that red that you see on the map along the Gulf Coast and the Southwest is going to start rising up further north. And so we had already recognized that, but this was her trip to go through those states and say, hey, folks, don't get complacent, because even though the numbers are going up, not very much, be very worried. And that's what prompted the governor to do the mask mandate that he instituted on July the 10th. And then the week that we're having this interview was the week that he did the 2-week pause on bars and then decreased indoor restaurants to a 25% capacity. So those 3 things are a way that we can hopefully, all of those will add together to bring us to a pause of our increase and possibly even seeing numbers going down. And if we can see those numbers going down, that's when I feel like we're winning. And we win when people recognize that this is a war. I can sit here at my desk and spout and talk and do all kinds of things, but until I go to a grocery store or wherever I go, which isn't very many places, if I don't see mask wearing, if I see people out in the park hanging out, literally hanging on each other with no mask on, that hurts my heart, because I know people were not messaging in a way that they're understanding that this is game on, this is serious, and in some cases it is life and death.
Speaking of a store, I just yesterday saw someone in a store, they had a mask, but it was all the way down here around their neck. So it's like,
I saw a woman in a store walk up to a guy and say, "That thing's not going to protect your Adam's apple. You got to wear that over your nose." I was instantly in love. She was my new best friend.
okay. Since we are in this war, we're looking at 2 weeks here at the end of July in Kentucky's numbers, and I took those numbers and I compared it with 2 weeks from around the world, the same 2 weeks, and these are the countries I included. Was Thailand, Vietnam, Denmark, Norway, Australia, New Zealand, and Italy, which at one point was one of the world's hotspots. And I added up all of their numbers. Those numbers came up to be 8,177 in 2 weeks. Our numbers for those same 2 weeks was 8,115 here at the end of July. What is it that other countries have done, especially something like Italy, which was the leading hotspot? What are they doing to win this war that maybe we're not doing?
Well, if you look at the Lombardy area in northern Italy, what they did, they had military on the street, and if they saw you out, you had to explain why you were on the street. And if you couldn't give a good reason, I'm not sure if they escorted you home or they you were told this was not acceptable.
Okay.
Mask wearing was required. The gentleman that owns the Thai restaurant here in Frankfurt says, you crazy Americans, in Thailand, the king said wear a mask. Everybody wore a mask. If you were quarantined, your neighbors watched you. And if you got outside your house, they would call and report you, because people took this very, very seriously. And that's just not something that happens in our country. And so we have to, if we could get 80% of the people to wear a mask, we would see a tremendous reversal of this illness. And I hope we get there, and I hope we get there quickly, so we don't have any more spread of illness and death.
So I would say probably one of our bigger enemies to mask wearing is social media. You have a lot of memes and things that are being shared that are, anti-mask. You also have people that are saying, well, this virus will disappear in November after the election, or you have people
that one.
Oh,
Sorry.
So, or you might have them saying that it's, not like the flu is more of a serious virus, or that maybe even states lie about their numbers. And like, I've heard someone say, oh, I know somebody that died in a car crash and the state put them down as a so there's a lot of misinformation that is being shared. But the people that are either sharing or believing these things, what would you, just like what you were saying, what would you say to them? What would be your message to those?
Well, I think they're doing a great disservice, because they're talking about something they don't know anything about. If someone dies in Kentucky and they are COVID positive, if they're killed in an automobile accident, we don't count that. If it's someone, we actually even have a committee that I happen to be on of several physicians and some of our lead epidemiologists. And if we have cases, I mean, if someone is COVID positive and dies in a hospital of respiratory failure or renal failure, and it's very clear that was the cause of death, then that's counted as a COVID death. If we have someone who went in the hospital, was COVID positive, went home and died a month later, then we look at that. We want to look at hospital records, medical records, and say, was this a spiraling out of control death that someone went home for palliative care because they didn't want to die in the hospital? Or was this truly, and I'm blanking on the famous actor's name, the Broadway actor that died just recently. He was COVID negative when he died, but certainly his death was spiraled out of control from an original COVID illness. He was in perfectly good health, and he would not have died at age, 43 years old or some horrible young age like that. So we anything that's not extraordinarily clear cut, we have a regular meeting where we review these deaths before we call them a COVID death. So that just shows that people that are sitting at home with too much time on their hands and nothing to do are coming up with ideas, and that's all they are, is ideas. It's, their statement's not based in any fact.
Okay. So we are learning facts. As you mentioned earlier, since March, we have been learning more and more about this virus. In March, we had, on March 13th, when our school shut down and went to online, on that single day across the whole United States was just 1,678 new cases of the virus. Now, I mean, we're seeing in the United States 60, 70,000 sometimes days of record-setting days and things of that. What is it that we have learned about the virus from March to today that we can say to folks, it's okay to reopen schools? Because we've learned, I mean, when we closed it, there was only 1,600 people. Now there's 60,000 people, but what we know, it's okay to reopen. What is it that we've learned?
Well, I think the problem with public health is, if public health really works well, you don't have those horrific outcomes. And then people say, well, we didn't have a disaster. We must not have needed to have done that. Well, the reason you didn't have the disaster is because you did the public health measures. So it's kind of a lose-lose situation for us. If we're extremely successful, then we look like a failure because you didn't have this horrific outcome. So that's what we live with. But what we know that we didn't know in March, we didn't know anything about the viral spread. Right at that point, we weren't even recommending masks because our healthcare system so desperately needed PPE. We did not understand in March how critically important that was. So now that we know how the virus does spread with respiratory droplets, we know that wearing a mask, we initially had tests that showed us that wearing a mask keeps my respiratory droplets, which is a nice medical term for spit, it keeps it from getting on other people. So a mask will keep me from spreading to others, which is my duty as a citizen to help other people. Now we know, with more look at this, that it helps to protect me, makes logical sense, from other people's viral droplets, the respiratory droplets that are each droplet is loaded with thousands and thousands of viral particles. So we continue to learn. Is it aerosolized? As of today, we don't have evidence that shows that. In a month from now, if your students are watching this in a month, we may know that. And we may also have evidence that shows it doesn't spread that way. Right now, all we can say is we don't know. See how easy I said that? We don't know. Okay. But we're learning. We're learning a great deal. We've learned a great deal about how to treat people. So our survival rate is better for two reasons. Number one, we don't have people lined up in ambulances as they did in New York City waiting to come into the hospital, literally dying in the ambulance waiting to come into the hospital. Right now, we don't have physicians who are looking at 3 patients and 2 ventilators and saying, you probably weren't going to make it anyway, so we're not going to put you on the vent. We're going to put these two people over here. I've never had to, as a physician, make a decision like that. I can't imagine what goes through all the healthcare workers on that team when they know that they walked away from a gurney or a bed and did not provide care for that person. We know about turning patients and just laying them on their stomach and laying them back and forth. That tends to help. We know different ventilator settings. We know that dexamethasone is helpful. There is some good hope that remdesivir will cut your hospital stay down by 5 days, which to some people doesn't sound like a lot, but 5 days less in the ICU is a tremendous help. So our care is better. We have better PPE, so we're not putting healthcare providers at risk, as well as them not being protected to protect the patients. So there's a lot of things that we've learned, and if we can learn as much in the next 4 months as we've learned in the last 4 months, we will be very far ahead of the game.
So it's been a great learning curve for us.
It has been a very steep one, yes.
Okay. It is almost August. So, you know, some school districts have already decided to start off with NTI. Some schools are at this point still planning on being full rosters. Others are looking at the hybrid model. As a caretaker and one that's very knowledgeable, Dr. White, what would you say to the students and parents and family and faculty and teachers that might have a fear of returning to school? If their school saying, we're going to open up, what would you say to them about returning to school?
Well, the Department for Public Health has worked with the Kentucky Department of Education, and we put together what Commissioner Brown, the commissioner of KDE, is calling the flagship document. And what that was our team, as well as KDE's team, sitting down and working together and saying, what are we call it the safety expectations. What's the floor, the basic thing we want every single school to do? Okay. And then in that document, we added best practices. You can do this, but it would be really nice if you could do that. So the safety expectations and the problem with public health is we are not particularly exciting and exotic. Public health is very basic. We've been doing these public health measures for decades, and they are things like wearing a face mask. So we are recommending that every student from first grade up wear a face mask at all times, unless you're sitting in a room 6 feet apart from the other students and no one is moving around in that room. So if you're sitting there, you can drop the mask, but when someone moves, somebody gets up to go to the trash can, the teacher comes over to you need to put that mask back up. Okay. So face masks are going to be critical. We're recommending daily temperature checks on everybody that comes into the building. So we could, even though everyone doesn't have a fever, and 16% of children don't have symptoms, it's much lower in the adult population than we think there's a higher number of people that are asymptomatic, and children appears to be lower. But we're hoping we can catch a child before that child or that student gets into the classroom building, because once they get in the building, then we have to track where did they go, who did they see, how long did they talk to them, did they have the mask on, did the other person have the mask on, who else would need to be quarantined. We've got some specific guidelines for sanitation, so that the surfaces that are high touch are cleaned routinely more than usual. And then the social distancing that we talked about. And we feel like, and I'll give you a great example, it was in the MMWR, which is the weekly CDC magazine. There were 2 hairdressers, and I believe they were in Missouri. Both of them came to work, and if you remember when our salons opened back up, people were just, dying to get in. I haven't been yet, but they were dying to get in. And so these 2, they were symptomatic, went back to work anyway. And between the 2 of them, and these were for women, so women sit in a chair much longer than men do. About 156, I believe, and I probably don't have that number right, but it was in that range. 156 clients between the 2 of them. The hairdressers wore masks the whole time, and the salon required that every client wore a mask the whole time. Not one of those clients converted to COVID positive.
Wow.
And that just shows the power of this little cloth mask. It can make a world of difference. It's how we're going to live in the COVID world until we get vaccine, until we get treatment, until we get cured.
So, I mean, it's right there. It's a huge testament then if it's those kind of numbers. So, final question for you is, doctors are the most amazing caretakers. I mean, that's what the job of a doctor is to be, is a caretaker and care provider. And you guys are champions at it. We have a lot of young individuals that are really hurting emotionally, spiritually, mentally. They lost their spring sports seasons, they lost their clubs and play productions. They might have family members that have been impacted by the virus itself. They might have a family member that's lost their job due to the pandemic. So there's a lot of youth out there that are really hurting, and they just want to get back to a normal world. As one of our great caretakers, what do you tell those young people that are really struggling right now?
I think that for all of us, we need to have purpose. And I think the purpose that they are used to, their clubs, their sports, their whatever they've always done in their adolescent life, that purpose is gone. So until we, even as adults, find a new purpose, then we're going to be floundering and lost. And whether you do that with meditation, whether you do that with a religious faith, or whether you do that with civic activities, whether you say, I'm going to start a club, and I'm giving examples I've heard of adolescents doing, starting a club where you make sure that all the older people in your neighborhood are checked on every day, and do you need groceries? Okay. Starting a club that makes children's masks and takes it to children's hospitals. Starting a club that goes around to different neighborhoods and plays a concert at 5 o'clock every night on the sidewalk. There are so many creative things, and our adolescents are so much more brilliant than my generation is, because you talked about social media. I smiled. I don't tweet or twit or whatever that stuff is. I do Instagram. My friends from medical school, there are 3 of them, and I just stalk them. I don't ever put anything on. I just watch what they're doing. So I know nothing of that whole world. Okay. And there are a world of things that they can get involved in, as long as they're and make sure you don't use unreliable sources for your information. But you could, with your youth and your enthusiasm, there are other people hurting as well, and your energy that could be shared with others that don't have your energy. They are truly lost with no resources. You building a group of people that can go out and be a part of their lives and make their lives more livable is not only rewarding for them, but it will be extremely rewarding for you. I'm a knitter. I doubt many of your class is knitters, although there are some very famous knitters and needle pointers in the sports world. But I learned long ago from my mother, I can knit a cap, a scarf, or I can knit a cap or a scarf and I can take it down to the men's homeless shelter. And I get so much more out of knitting that scarf, knowing it's going to someone who doesn't have anything and can be warmed by this, not a third cousin once removed who's going to put it on once and throw it away. Not only will it help someone else, but I get so much of a blessing out of doing that. And I think once we get over the trauma emotionally of my world's been taken away from me, then we build a new one. We build a new world that we may even find parts of it are better than the world we left. Some people have clinical depression and they need us in other ways. But I think that the people listening to this interview have great skills and great gifts, and it's harnessing those gifts and giving them to others is what's going to get everybody through this.
Wow. Thank you so much, Dr. White.
Thank you for having me. I've never spoken to a boys' school civics club before.
Yeah, it's a new way of teaching. So, but I think if if we can have a way of connecting the guys with the information out there, and Zoom has been a blessing for us to make these connections happen. So thank you for the work that you're doing, and thank you for joining us on this conversation, and you stay safe yourself.
I will. So catch up with me next semester and we'll see where we are.
Fellas, thanks for watching. Dr. White, thanks for being a part of the class. And that is it for us today. As always, guys, remain awesome, be nice, stay safe, and I will be seeing you soon.